Well, over the past decades, the number of people who die from or have been disabled after a stroke has decreased considerably with medical treatment advances and a better understanding of all the risk factors.
For this stroke month, experts warn there are still significant racial disparities. Dr. Frank McGeorge is here now with the wide gap and what can be done to narrow that gap, Frank.
Yeah, Kim and Devin. So, according to the American Heart Association, young black adults are almost 4 times more likely than their white counterparts to have a stroke. And according to the National Center for Health Statistics, the risk of having a first stroke is nearly twice as high for blacks as for whites. Black individuals are also more likely to die from a stroke.
We know that African Americans have their stroke younger. So what does that mean? It means that it's impacting their community, it's impacting their work, their families at a younger age, and it is a significant disability burden on the communities of color.
Dr. Dawn Kleindorfer is the chair of neurology at University of Michigan Health. She says there are many steps that can be taken at both an individual and collective level.
It may be related to better education of our communities of color related to their risk, how to reduce their risk, things that they can do once they start having a stroke. It may be that we need to teach our doctors more about treating patients in communities of color and understanding their unique challenges and helping them with their social determinants of health. And it may be related to the society at large, and we really must work on tackling these disparities amongst our patients so that everyone can have equitable care.
U of M Health currently has programs running to understand and reduce disparities in stroke care. One is based in Flint, Michigan, teaching people about stroke warning signs and risk factors and learning about how decisions are made by community members when a stroke occurs.
Now, one thing that's easy for anyone to remember when it comes to the signs of stroke is the acronym FAST, but it's actually undergone a makeover. Try instead to remember B-FAST. The B stands for balance difficulty, E stands for eye or vision difficulty, F stands for face weakness, A stands for arm weakness, S is for speech difficulty, and T is for time, to emphasize that this is an emergency and you should not hesitate to call 911 to get to an emergency room for evaluation. I should mention, you don't need all of those symptoms. You only need one to be concerned.
Symptoms, right, but it truly is essential to seek help quickly for treatment reasons, correct?
Yeah, absolutely. In fact, the treatments that we use for strokes basically have the best result the sooner they are given from the time of symptom onset. And the most common treatment, the so-called clot busters, TPA, and now also something called TNK, generally have a limit of 4.5 hours to be given. So if you delay, you will probably be too late to use those medications in particular.
The essence always.
Absolutely.
Okay, thanks, Doc.